This is Mon Health Talk, a weekly program focusing on the dedicated physicians, nurses, and staff at Mon Health, the region's premier community hospital system. People with skillful hands and bright minds using state-of-the-art technology. We don't just practice medicine, we care for people like family. That's why at Mon Health you can feel the difference. Once again, welcome to this edition of Mon Health Talk.
Good morning. Welcome into the program. It's Mon Health Talk. I'm Dave Wilson. Our guest this morning is Dr. Littles, radiation oncologist, Mon Health Cancer Center. Good morning, Dr. Littles.
Good morning, Dave. We haven't talked in a while.
I know. It's been too long. Where have you been?
I've been good. And just as a side, I graduated from Wilson High School.
Did you really? Where is that?
I did, in South Carolina.
Okay. That is a bit of a coincidence. That's. I won't ask when you graduated, though, Dr. Littles. See, that's the key.
It's all good.
Well, appreciate you taking a few minutes. You've certainly been a guest on this show before, but just remind folks of your background and how you ended up with Mon Health.
Great. I grew up in South Carolina and did my training in Michigan and was with the University of Michigan for a decade. And, about 4 years ago, heard from a recruiter from Morgantown, West Virginia, and I was only familiar with Morgantown because my daughters went to college at Howard University, and when you drive from Michigan to D.C., you drive by Morgantown, and I just recognized it as a small university city, very similar to Ann Arbor, Michigan, with a southern twist. And when I heard from the recruiter, I decided to follow up, and a good friend of mine had a Ford dealership in Morgantown, and he also had a lot of great things to say about Morgantown. So, I came to take a look, and the rest is history.
Well, glad to have you back on the show. Where physically do you practice? Do you go to several different offices around the area?
Oh, thank you very much. Good question. No, I'm here at Mon General Hospital. The radiation oncology department is a multi-million-dollar highly technical facility based on our specialty, and so it's only really at one place for the Mon Health system.
And obviously, October is Breast Cancer Awareness Month. Folks probably noticing if you're watching NFL or actually any of the sporting events over the weekend, the pink flags, the pink shoes, pink hats. It's everywhere, so I think people are very aware of it. So how does radiation oncology play a role in breast cancer awareness, the treatments, the detection, the whole nine yards? How do you factor into the picture?
Great. As a radiation oncologist, Dave, I treat cancer patients with x-rays. And since 1985, several major randomized studies have been done all over the world, giving women an opportunity to keep their breasts and not risk their life. So they have an excellent choice now to, once they're diagnosed with early-stage breast cancer, to have a lumpectomy and radiation and keep their breasts. And there are studies all over the world to verify that has major quality of life issues. So that's one role I play. The other role I play when patients have locally advanced breast cancer and a mastectomy is appropriate and there's still a tremendous risk over the following 2 to 5 years of the cancer coming back regionally, I usually give chest wall and what's called regional nodal irradiation. And there's also, unfortunately, a subset of patients with breast cancer that are unresectable. And I give them usually what we call definitive radiation to try to control the area as best we can with the aid of chemotherapy and hormone therapy. And some of those patients have phenomenal responses. There's also patients, unfortunately, that have breast cancer that are spread to other parts of the body, like the liver and the lung. And in 2022, we're able to treat those areas sometimes, if appropriate, aggressively. And that adds a major quality of life issue. So within the field of radiation oncology, we work very well with the surgeons and the medical oncologists, and so we sort of have our place.
It really is a team approach when it comes to developing a cancer treatment plan. It's not just one doctor, but there's a whole team that are involved in developing the plan, correct?
Absolutely, and the biggest advantage to Mon, because we're somewhat of a smaller institution, but roughly fully functional as a cancer institution. We're a very small community, and we talk to each other all the time, and we come up with a symbiotic plan that works well for the patients, and it's much easier for us to communicate because of our smallness and proximity to each other. As a matter of fact, my office is a 10-second walk to the medical oncologist's office, 10 seconds. And so, we have each other's cell phones. We talk at night. We talk on the weekend. We're communicating in the best interest of the patient.
Talking to Dr. Littles this morning, radiation oncologist. Obviously, for each patient, you'll develop an individualized treatment plan for each patient, but can you give us, generally speaking, some of the options that are available to treat breast cancer?
Absolutely. Early stage breast cancer, and I'm a tremendous advocate of mammograms, and I'll just give you the great news right off the bat. So the death rate of breast cancer since 1989 has dropped a whopping 40%.
Wow.
And what that transposed to is 376,000 breast cancer lives that have been saved. And that's with mammograms, and mammograms again, and then systemic hormone therapy, which is anti-hormone therapy. So mammograms and anti-hormone therapy has added to that. So the first step is to get your mammogram early and often, and most cancer specialists would recommend it to be on a yearly basis. So once you are detected with early breast cancer or even non-invasive breast cancer, our talented group of surgeons will offer you either a mastectomy or lumpectomy, and those who choose a lumpectomy will go right into, after they heal up from the lumpectomy, will get classically 3 to 4 weeks of radiation. And then after that, if they are what we call estrogen receptor positive, they go into hormone therapy. If they have locally advanced breast cancer and they're appropriate to what's called neoadjuvant therapy, then they would get 3 to 4 cycles of chemotherapy, depending on how well they respond. And a lot of the patients are responding phenomenally based on the research that has happened over the last 20, 30 years. They can go on to even breast-conserving surgery, followed by radiation, or a mastectomy, followed by regional irradiation. So there are a lot of tools in the box in 2022, and once again, the surgeons and Dr. Collins and I, we work very, very well together, and we communicate often about what it is in the best interest of patients.
How does family history factor into choosing treatment options?
Well, family history, for a small subset of patients, I would say the literature says roughly 3%. For a small subset of patients, family history has a tremendous role. And I will briefly mention something called the breast cancer gene, BRCA1 and BRCA2. That, again, is just in 3% of the population. For the majority of it, it's called sporadic breast cancer for most of the breast cancer cases. And family history doesn't have much of a role that we can put our hand on.
Talking to Dr. Littles, radiation oncologist this morning, Mon Health Cancer Center. Got to squeeze in a quick break. We'll continue our conversation in just a moment. You're listening to Mon Health Talk on WAJR.
Now back to Mon Health Talk, a discussion of the issues, people, and procedures in healthcare today. If you have a question for one of our healthcare guests, call now at 304-296-0041.
Radiation oncologist Dr. Littles, Mon Health Cancer Center, joining us this morning here on Mon Health Talk. And Dr. Littles, when patients are diagnosed with cancer, there are many factors that can be scary, and treatment is one of them, especially if radiation is involved. What are some of the side effects of radiation, and how do you mitigate those as much as possible?
That is a great question, Dave. And what I do is I spend a lot of time with my patients when I see them for an initial consult. And one of the reasons why I spend a lot of time with them is there are a lot of myths out there about radiation. I mean, there's so much. Well, one of the things that I tell them is that radiation is like high-tech target practice, aim and fire. So it is nothing like chemotherapy. It is nothing like hormone therapy. So when I treat, for example, if I treat the right breast, I have no impact on the left breast. I have no impact on the hair on their head. I have no impact on their eyes, their teeth, their liver, their kidney, their bowel, their rectum, none whatsoever. And one of the things that attracted me about Mon Health is when they built the department a few years ago, they spent several $1 million. They did it the right way through the foundation help. They had outstanding equipment. And when I came here, I asked for what could be called a little tweak to make sure that I could deliver radiation to my patients in a safe, effective, convenient, and rapid way. And so when the technical staff treats the patient every day, the vision I give them is perfection. So we're not in a hurry. We're in a perfect. So the side effects are fatigue, skin reaction, lung scarring, rib tenderness, which could lead to a rib fracture. Rib fracture, not likely to happen. The lung scarring will be of no clinical significance. I make sure I protect the heart. I make sure I protect the lung. Dave, I have more jokes than you can imagine, but I'm absolutely super serious about my patients. So I check, double check, and triple check everything before the patient is treated. So my role in the department is really analogous to an orchestra director. I really don't play any of the instruments, but I know exactly how it should sound, and I ensure perfection. So, and I have a great team, and they've caught the vision, and we're riding well. So, for example, if I treat a patient for breast cancer and they see a dentist 2 years later, the dentist may erroneously be nervous about dental issues in reference to radiation. If I'm treating the breast below the clavicle, there are no dental issues, none whatsoever. So again, there's a lot of myths out there about what I do in radiation. So really, once again, high-tech target practice, and everything is confined to the area that we treat, and we have a very sophisticated machine. We're very, very meticulous, and we minimize side effects.
I like that metaphor there because it's visually it works for me. The high-tech target practice. I think many of us just have that idea in our head from, I don't know, maybe 20 years ago, 25 years ago of what the technology was then, but it has come so far, even in the last 10 to 15 years, that, again, the metaphor really lands for me, that high-tech target practice. It isn't just random shooting or taking a sledgehammer. This is, to use surgical terms, taking a scalpel to the issue. Is that fair to say?
Very much. If you think about how the military hits their targets from 5 miles away now, very different than they did 10, 15 years ago. If you think about how computers have evolved over the past 10 to 15 years, if you think about the technology of the automobile industry compared to 10, 15 years ago, medicine changes on a monthly, yearly basis. And that's why, I'm supported when I go to conferences every year, having access to the literature and having quality reviews every week. So, medicine, specifically radiation oncology, is a very, very, very dynamic process. And we're making great moves. When I tell you that the death rate has dropped 40% since 1989, that is tremendous news. And when you talk about 376,000 deaths, breast cancer deaths being avoided, that is absolutely tremendous. And the same thing are happening.
Talk of the town coming up at 9:06.
Go ahead there. Sorry about that.
No, I'm sorry.
Nope. I just had something jump in there on us. Talking to Dr. Littles this morning, radiation oncologist. Do you ever take a moment to just stand back and go, I can't believe how far we've come throughout the course of your career, just as you treat patients? Because to me, the death rate dropping, or maybe a positive spin, the survivor rate going up, that is real numbers. That's just not statistic. That is real success there.
Oh, there's no question, Dave. Not only do I take the time to do it, I'm thankful every morning and every night when I leave my office. I'm one of those people that just really enjoy what they do. I've been in the field long enough to see a lot of these differences, and I take the time to explain these differences to the patient. I said, here's what we want to do This is somewhat new, but this is why we want to do it, because 30 years ago, we didn't know this, and this is what we did because we didn't know. And now we need this other test because this allows us to know and allows us to treat you like we're in 2022, not like 1992.
Talking to Dr. Littles. Before we take our break here, Dr. Littles, I just want to make sure we get in. Where can patients get their annual mammograms through Mon Health to prevent breast cancer? So hopefully, I mean, you're a pretty nice guy. I'd love to hang out, but I really don't want to come see you as a physician.
I heard that before.
So where can patients get these mammograms and detect this early?
Well, first of all, American Cancer Society and the American Society of Breast Surgeons, well, specifically the American Society of Breast Surgeons, recommends their first mammogram at age 45, and then yearly mammograms up until age 70 or 80 or maybe even higher. I just saw someone yesterday who, this week was 70 years old. Their mother's alive in her mid-90s, and she could pass her 60s. So I would suggest she look at really doing mammograms up until age 80, 85, unless something untoward happens. But www.monhealth.com/mammogram, www.monhealth.com/mammogram.
We'll take our final break. We'll be back to wrap things up with Dr. Littles, radiation oncologist, Mon Health Cancer Center, in a moment. You're listening to Mon Health Talk on WAJR.
This is Mon Health Talk, providing a window into the Mon Health system and the dedicated healthcare providers who work there. If you'd like to comment or ask a question, please call 304-296-0041.
Got just about a minute left with Dr. Littles. Dr. Littles, there's a Facebook Live event coming up this week. What can you tell us?
It should be very informative. Dr. Causey, Brad Hamrick is a person that I work with every day, talented young man. Theta Embarker, talented nurse. I've worked with her often. So they are very caring and talented people and very knowledgeable and should be worth everyone's time to take a peek.
That comes up on Wednesday. It's 6:30 to 7, and you can get details at the Mon Health System Facebook page. And you could even submit questions to participate in that discussion. How can people reach out to you, learn more information, or schedule a mammogram?
Well, scheduling a mammogram, monhealth.com/mammogram. Contact my office through monhealth.com/cancer.
Dr. Littles, always fun talking to you. Stop by anytime.
Thanks, Dave. You as well. Please say hello to Sarah.
Will do. Dr. Littles, radiation oncologist, Mon Health Cancer Center, our guest today. You've been listening to Mon Health Talk on WAJR.